toxin by bacteria, which produces local infection, the GIT, that is vomiting, diarrhea, and general eruption, that is fever. صوت واضح لكم هسه؟ اكتبوها بالشات. هسه الصوت واضح؟ Okay? Okay, let's turn the microphone. Okay. Good. Okay. So we continue with the lecture. Okay. Starting with infection. Infection means infection that enter invasion of the microorganisms to the human body, either by the microorganism itself and the commensal microorganisms or pathogenic microorganisms, or sometimes the invasion to the human body is by the products of the microorganisms. Okay, its products. So, commensal microorganisms mean by them, sometimes called microbiomes, that microorganisms that normally live on the surface of the human body, that live on the GIT, okay, that live in the GIT. These microorganisms normally live on the human body, and they do not cause an infectious disease unless there is certain conditions such as decrease in the immunity of the human body. Whereas pathogenic microorganisms means microorganisms that live outside the body in the human nature, and sometimes when the human is exposed to these microorganisms, they cause disease to the human. Whereas the products of these microorganisms, mainly the products presented toxin invade the body and cause disease. Best example of this is in case of food poisoning, in contaminated food by bacteria which produce toxin present in the food. This food contaminated by toxin may cause local reactions such as gastroenteritis, vomiting, diarrhea, and also associated sometimes with general reaction such as fever. Commensal microorganisms we have talked about. They are microorganisms living on the surface of the human body. Usually they do not cause infection. Their number is high number. يقدر بحوالي 10 أضعاف human body. Okay, بالنسبة to cells of the body. And when there is decrease in the immunity, such microorganisms may cause infection. And such infections are called opportunistic infections. The outcome of infection, that is when the person exposed to infectious agent, this outcome of infection depends on the balance between the aggressive factors of the microorganisms and the defense of the host. That is, the more defense of the host, they will be less likely to develop infection, this one, and is that when there is a decrease in the host immunity, the microorganism cause severe infection. Also, some microorganisms have low pathogenicity, they cause mild disease, whereas others cause severe disease. We have certain terms you should know in infectious agents. infectious pathology. First of all, we have infectious diseases. When I call infectious disease means different from other diseases. Ako other diseases, autoimmune diseases, ako diseases due to hemodynamic disturbances or metabolic diseases. Whereas in infectious diseases, diseases that caused by infectious agent and they are transmissible. يعني not ما فقط بأنهم microorganisms cause the disease. لكن the person when get the infection, they may transfer the infection to other people. So it's a transmissible disease and communicable disease. And this spread may be directly from person to person, and best example of this is pregnant female. When get infection, they may transfer the infection to her baby in fetus. مثلا هي pregnant ممكن infection transmitted to her baby. But this is directly. Or sometimes indirectly, this infections may be transmitted directly, such as in air droplets, or sometimes a contamination of water, or sometimes contaminated wood, or sometimes by vectors such as methylene presence in malaria bugs. Infection, sometimes when a person develops infectious disease, not always develop infection when get organism enter the human body. This is not always associated with disease, symptoms or signs. And some infectious agent when enter the body, they establish asymptomatic carrier state or dormant state. That is, they remain in the human body without developing of any symptoms, and they may spread themselves, the infectious agents, without any sense from the human being. The term infectivity, we mean by term infectivity, is the ability of the microorganism to gain entry and proliferate to the host. يعني, the more the infectivity of the infectious agent, the more likely the microorganism can cause disease to the human being. Whereas the term contagious disease means disease that is transmissible, easily transmitted from person to person. And these contagious diseases, best example of this is coronavirus. يعني معناتها we can know that there is contagious disease. This requires a quarantine. It is infectious disease, but requires quarantine to limit its spread because easily transmitted. Whereas non-contagious diseases, they are infectious diseases, but are not contagious. The best example of this is sexually transmitted diseases. Sexually transmitted diseases because they are transmitted only through the sexual intercourse, or other diseases. Virulence. Okay, regarding virulence means the ability of the microorganism to cause aggressive disease. So the more virulent the microorganism, the more pathogenic the disease, more pathogenic the microorganism, and more ability to cause severe disease. Another term is that a primary pathogen and opportunistic pathogen. A primary pathogen, as we said before, it is pathogen that causes disease from itself, by itself, that is not present on the healthy normal human host. Okay? It causes the disease by its virulence by itself. Whereas here, the opportunistic pathogens means opportunistic pathogens, that pathogens living on the human body, but they cause disease when there is decrease in the immunity by causing opportunistic infection. Example of this is Candida. Sometimes it's normal, but it's present in the mouth or in the GIT as part of the normal flora. But when there is suppression of the immunity, they flourish and cause disease. The other term is that zoonotic diseases. In zoonotic diseases means diseases that are transmitted from animals to a human being, whether this is transmitted through meat or its product like contaminated milk or even secretions. The infectious agent, there are many types of infectious agent, and their classification differs according to their structure, to their ultrastructural features. We have living infectious agents, that is viable infectious agents, and we have non-living viable infectious agents. The best example of non-living material is prions. Prions representing protein. They are non-living objects. They are proteins. They present in the cattle and the cows, and they cause disease, Creutzfeldt-Jakob disease. That is مرض جنون البقر. And when the humans eat contaminated meat or meat that contains these proteins, or even brain that contains these proteins get to the inside of the body and cause conformational change in the normal proteins. يعني الوين ما الانفكشن مالته انه اما يكون structure مالته مش shape abnormal، وعندما يدخلون الى داخل الجسم الهيومن راح يعملون shape of the normal proteins اللي present in the human brain of our brain. They make them also abnormal shape, and so they cause the infection by causing abnormal shape. فإذا infection by proteins, non-living objects. Whereas the living objects, the others are present in bacteria, viruses, fungi, and parasites. These may be unicellular or multicellular. Some of them contains nucleus, others they do not have a nucleus. The factors that influence the infection. We have many factors. We have factors related to the microorganism itself and factors related to the human. And we have other factors, which is a combination of both. The factors related to the microorganisms include, first of all, we have the dose, that is the number of the microorganism entering the human body. When the human is exposed, for example, to a small number of microorganisms, مثلا inside the GIT, مثلا toxic substances, فتكون a small number, the gastric acidity can then increase a small number. These microorganisms can, gastric acidity can damage these microorganisms, and so infection doesn't occur. Whereas when large number of microorganisms get to the inside, then they will cause infection. Virulence, that is the aggressiveness of the microorganisms. The more aggressive the microorganisms, the more likely it can cause the disease. And there is the invasiveness of the microorganisms. The invasiveness of microorganisms here, the ability to multiply and spread into the inside of the body. Some microorganisms, when enter to the inside of the body, they remain localized to the site of entry and proliferate there. Whereas others, they cause secret substances such as enzymes that cause lysis of the extracellular matrix and cause spread of infection such as cellulitis. 4 is that transmission of the disease. Here, the ability of the microorganism to transmit the disease to others, and with our various ways, including inhalation, ingestion, and others. Whereas the host defense mechanisms, we have either specific defense mechanisms or non-specific defense mechanisms. Non-specific defense mechanisms, or sometimes it is called the innate immunity. These defense mechanisms, these are general defense mechanisms against any type of infectious agent. They are not specifically targeted against certain types or species of microorganisms. These include mechanical barriers such as the intact skin. The skin is covered by keratinized stratified epithelium, and such keratin layer protect the skin, protect the human being from entry of microorganism. The other is that the glandular secretions. We have many secretions inside the body that protect the human body and from the infectious agent. This includes the acidity of the gastric juice, kill microorganism, the sweaty gland acidity. Secretions contain IgA antibodies, and these IgA antibodies kill the microorganism, prevent them from entry. These secretions include the respiratory secretions or GIT secretions, or some even the blood. The other is that the secretion current. We means particularly secretion current, that is the flow of the fluid, and this flow washes the microorganisms even when enter to the human being. The example of this in case of diarrhea, the person will get infection, so the person will get gastroenteritis, diarrhea, and such diarrhea wash the proliferating microorganisms from the GIT, and so decreasing the load of the bacteria present in the GIT. Also, the urine, when you urinate, the urine flushes the urinary tract, the urethra, and to prevent the microorganisms from entry through the urethra and descending to the urinary bladder. The other is phagocytosis, and this phagocytosis is generally directed against various type of microorganisms. It's not specific, usually seen in macrophages and in neutrophils, and you have already talked about تم التحدث عنها في acute inflammation and the way of killing of microorganisms. The specific defense mechanisms, here defense mechanism means the immune system that is developed by vaccination, and the human being vaccine develop antibodies against bacteria or against viruses or even against toxin produced by bacteria, and these are specific. And these specific defense mechanisms, including the cell mediated by the cells themselves, cytotoxic cells, T cells, or sometimes the humoral immunity, which means the B cells, which produces the plasma cells, which in turn plasma cells produces antibodies. These antibodies, they are specific against certain microorganisms. And antibody-specific defense, microorganism-specific defense mechanism. Okay. الصوت واضح؟ نكمل. بالشات ممكن تكتبوا لي.
دكتور كلش ناصي.
كلش ناصي. والله this is the best. يعني المايك near my mouth. Okay. Now we continue. Other factors that may affect the infection, development of infection, including local factors that is in the host. First of all, مثلا ischemia. Ischemia, that is obstruction of blood vessels, and ischemic tissue get necrosis, yani dead tissue. And this dead tissue representing culture media for certain microorganisms called saprophytic microorganisms. That is microorganisms that need need dead tissue for its proliferation, so can cause gangrene. The other is that foreign body, that is when there is a blast injuries, when there is injuries or explosions, some shells enter inside the human body, and these shells are presenting nidus for repeated infection. The other one is that systemic disease and the systemic factor, including malnutrition, diabetes, and chronic alcoholism and malignancy. All of these diseases are systemic diseases are associated with decreased immunity of the host. And decreased immunity of the host make the human being is liable for infection. Regarding the age, we know that very young and very elderly people are more likely to develop infection than young people أو الشباب. The other is that drugs, the use of drugs. The current use of antibiotics have played a role in the decrease of infection, many infectious diseases, res malata, and their incidence, and also decreasing complications and death from these infectious agents. At the same time, the use of certain drugs, such as drugs used in the treatment of malignancies or immunosuppressive drugs that cause decrease in the bone marrow proliferation, and so there is decrease in the white BC count, leukopenia. And such drugs expose the person to infection and decreasing immunity, leukopenia, decreasing defense, so the person is liable to develop infectious disease. Now, this scheme talks about the way of dissemination, the way of entry and dissemination of microorganisms throughout the human body. First of all, the site of entry of microorganisms, the microorganism get entry to the inside of the human being either through the skin from the surface, or through the mucosa lining surfaces, whether in the lung or in the respiratory tract or in the GIT or in the urinary tract. Some microorganisms requires injury to these protective protective mechanisms, barriers, wounds in the skin, while others they do not require this. Just they penetrate the skin or penetrate the mucosa and establish themselves inside the human body. Some microorganisms get entry through the mucosa to the inside. Here, the spread the microorganism entry to the inside of the body is either local spread, that is the microorganism producing enzyme that cause lysis of the extracellular matrix, and then they spread there, causing local abscess, local infection. Whereas certain infectious agents, according to their types, they prefer the spread through the nerves. They get into the inside of the nerve endings to the axons, and then transmit to the ganglion cells and settle there. The best example of this is that varicella zoster, herpes. Another microorganism, they spread to the inside of the blood. They are carried through the blood. So carried either in the blood is either they are present in the plasma, transmit with the flow of the plasma present in the blood, and then transmitted through the lymphatics or the blood to other organs. Or some of them, they use the cells of the blood, that is the RBC and YBC, as a carrier for their transmission. Example of this in tuberculosis. The microorganism TB bacilli uses the macrophages as a way of the transmission. سفينة للعبور خلال البلد أو مثلا خلال RBC as is seen in melasmodium. When the microorganism then transmitted through the blood whether bacteremia or viremia, the certain microorganisms have a tropism for certain organs, such as hepatitis viruses. They have a tropism for liver, and so they settle in the liver. Ebivirus or mumps virus, they settle in the salivary glands. And other non-specific microorganisms, مثلا bacteria, they cause مثلا paranephritis or pneumonia or meningitis and so on. The result of infection, that is after the entry of microorganism to the inside of the human body, what will occur? What is the end of this? First of all, the best outcome, the good outcome, is that eradication of such infection. And such eradication is either by immunity or by use of antibiotic, which is the good results. Or في بعض الأحيان there will be persistence of infectious agent, that is the infection is still present inside the body and without any symptoms or sometimes associated with mild symptoms. علامات الانفكشن راح تستمر إلى سنوات، في بعض الأحيان تستمر مع طول العمر. The best example of this in case of hepatitis. Certain people develop carrier state or sometimes a chronic form of hepatitis that may last for years. Or there's sometimes the microorganism spread inside the human body from local infection, either directly causing cellulitis or through the lymphatics to the lymph nodes, or sometimes to the blood and involving other organs, so causing multiple diseases in other organs, مثلا multiple abscesses that occurs in multiple organs inside the body, and this is associated with severe disease. The last one, which is the bad effect, that it causes death. That is in case of severe infection by microorganism, and this is cause of death either directly by the microorganism itself, as in case of septicemia and septic shock, or sometimes by exaggerated reaction of the human against the microorganism. The best example of this is in COVID-19 infection. Now we will talk about the microscopical changes or microscopical responses associated with infectious agents. That is, when the microorganism get to the inside of the human body, they cause specific changes, microscopic changes inside the tissues that they affect. And this does not always occur. Okay, بعض microorganism changes might تكون non-specific, whereas other microorganisms changes are specific. And the benefit of this is that when we take biopsy from tissue and see these changes, we can know from these changes the causative agent, the type of a microorganism. Okay, starting with suppurative inflammation. The first one is that suppurative inflammation. Suppurative inflammation, inflammation means pus formation, abscess formation. So when we see abscess formation, that is pus, necrotic debris, exudate necrotic dead bacteria surrounded by pyogenic membrane and fibrosis. So there is abscess. We expect the cause is pyogenic bacteria such as Staph aureus. Sometimes we see a chronic inflammation, that is a chronic inflammatory cell infiltration associated with fibrosis. And this is occurred in certain virus infections, such as in case of liver infection by hepatitis B, causes fibrosis and liver cirrhosis, or sometimes by the parasites schistosomiasis lay their eggs inside the urinary bladder, and they cause reaction, body reaction against these eggs to our foreign body. There will be inflammation, a chronic inflammatory reaction against them, and fibrosis associated with calcification. Or even also tuberculosis, we see chronic inflammation because TB causes a granuloma. The other change or microscopic change is that mononuclear cell infiltrated granulomatous inflammation. And the granuloma are important because they give us a hint about the causative agent. The best example, a prototype of this is tuberculosis. Tuberculosis causes gaseating giant cell granuloma. So when a person of lymph node enlargement in the neck with abscess formation, biopsy is taken, we see granuloma. Okay, we see granuloma, gaseous necrosis, report this as granulomatous inflammation. The possible cause is TB. Okay, فإذا معناتها this microscopic change يعطينا hint about the causative agent, وبهذا نشخص المرض and then give exact treatment. The fourth one is that there will be cytopathic and cytoproliferative inflammation. And these changes are associated with viral infections. The viruses, when enter to the inside of the human body, to the inside of the cells, they replicate and increase their DNA or RNA particles. And this produces inclusion bodies, whether nuclear or cytoplasmic inclusion bodies. Also, they induce the cells sometimes to lyse, or sometimes cause the cells to fuse together, then producing giant cells. Within giant cells plus viral inclusions at الانطباع بأنه this is viral infection. أو في بعض الأحيان أنه the virus induce the cell to proliferate. The best example of this is that wart, الفألول, وهو أنه infection by human papilloma virus to the inside surface epithelium of the skin, and this virus enters the cell, induces the cell to proliferate and producing papillary structures اللي هي wart. The other change is that necrotizing inflammation. Necrotizing inflammation usually caused by the microorganism when it produces powerful toxins. An example of this is that Clostridia perfringens when causing gangrene, resulting in necrosis, lysis of the cells and extracellular matrix. Or sometimes by parasites such as in histolytica, in case of amoebiasis, and this amoebiasis can get infection. They cause lysis of the tissue in the gastrointestinal tract, producing abscesses in the wall of the gastrointestinal tract in the intestine due to lysis of the surrounding tissue and mucosa. Now, starting with bacterial infections. Bacteria أعتقد بأن التفاصيل مالتها وهذه الأمور كنا ختمها بالميكروبيولوجي. We have different ways for classification of bacteria according to their criteria. Either classified according to the gram stain, we stain the microorganism and see their color. فإما تكون gram negative, red in color, or gram positive, deep blue in color. Or sometimes according to their shape. ممكن الشيب مالتها إذا كانت كوكاي round structures كروية, bacilli that is rods, or vibrios ضمية الشيب مالتها coma shape, or sometimes spirochetes يعني twisted microorganisms. Or بعض الأحيان على their growth يعني specific functional features أو growth requirements. مثلا bacteria classified into aerobic that is require air for their growth, or anaerobic, that it doesn't require air for their growth. How does bacteria cause disease? Bacteria will get inside to the human body, to the host. How does it cause the disease? There are several mechanisms. Either the bacteria, they proliferate and they produce toxin from themselves, and this toxin could be part of their wall. It is called endotoxin, a component of their wall phospholipid layer. Okay, or sometimes they synthesize this toxin and secrete it to the outside, and causes the damage to the human body. Example of this, مثلا diphtheria will secrete toxins, Clostridia secrete toxins and enzymes. The Clostridia مع الانزيمز اكو certain من toxin مثلا Clostridia botulism. Endotoxin, as in case of gram-positive and gram-negative bacteria, when causing septic shock, اللي تحدث عنه الدكتور إخلاص في محاضرات السابقة بالهيمودynamic disturbances. Or sometimes the second one is that the bacteria causing disease by the production of enzymes, and these enzymes cause lysis of the target tissue, whether the cell, causing lysis of the cell to the surrounding supportive stroma, collagen, extracellular matrix, causing lysis. These various enzymes, including proteases, hyaluronidase, coagulases, and fibrinolysis. Such lysis of connective tissue cells and also connective tissue make it easy for the microorganisms to be spread, and is one of the way in causing the type of necrosis which is called the refractive necrosis. Okay, then producing abscess formation. لكن الديفنس for human body راح تسوي surrounding fibrosis, containment for infection. The other one is that the microorganism get to the inside of the human body through its inflammatory reaction. يعني here that doesn't produce enzyme. These microorganisms don't produce enzymes. They do not produce toxin, but just they enter to the inside of the human body. They establish proliferation, colonization. Okay, لكن part of protective mechanism, the human body is trying to get rid from these microorganisms through an inflammatory reaction. And such an inflammatory reaction sometimes is associated with damage to the organs affected. The best example of this is TB, tuberculosis. When microorganisms get inside the body, they do not produce toxin or enzymes, but they induce an inflammatory reaction. There will be formation of a granuloma. Thus, granulomatous inflammation, when excessive granulomatous inflammation occur, can damage part of the tissue. Then part of the lung, fibrosis, damage. The lymph nodes involved will be damaged. The fourth mechanism is that through the immune reaction. An immune reaction here we means by it that is a cross reaction. وهو أنه best example of this is upper respiratory tract infection. Child, for example, 10 years old, develop infection in the pharynx, that is pharyngitis, okay, by streptococci. But after healing, defense mechanism against this by production of antibodies, okay? These antibodies will kill the streptococci present in the pharynx, okay? The patient or child will resolve from such infection. لكن these antibodies اللي الجسم أنتجه against streptococci, they cross-react with antigens on the glomeruli. فإذا تهاجم أيضا antigens present on the glomeruli, so causing post-streptococcal glomerulitis or other diseases. Okay, this is a small cross-reactivity. The bacterial infections in general are classified into acute and chronic. Acute, sudden, severe, chronic, gradual onset of long period of time. We have certain changes. يعني تقريبا متداخل مع these changes اللي caused by bacteria متداخل مع inflammatory changes أو acute inflammatory changes. الرزس مالته ما مهمة جدا كثير، لكن عندنا مثلا كتارة that is when there is infection of a mucous membrane, and this infection is associated with the production of much mucus material. Serous infections, here infections in the pleural cavity or peritoneal cavity associated with more production of a fluid, an accumulation of fluid, pleural effusion, or ascites. Some infections are associated with necrosis of the overlying mucosa with formation of membrane-like structure كلر مالته قد يجوز gray, yellow, greenish color حسب الكomposition مالته, and this is called pseudomembrane, which is formed of bacteria, necrotic debris, necrotic mucosal cells, bacterial cells. This example of this is pseudomembranous colitis. Or بعض البكتيريا they cause polygenic or pyogenic bacteria they cause suppuration, that is, it will be formation of pus. This is an example of abscess formation in the neck associated with features of inflammation, that is redness and swelling. And this is an example of pseudomembranous colitis. We see ulceration of the lining of the external mucosa associated with here high patches, yellowish greenish patches. These yellowish greenish patches representing a pseudomembrane اللي هو covering the ulcerated mucosa, and these are composed from the exudate inflammatory cells, necrotic debris, necrotic microorganisms. We have you should know when bacteria get to the inside of the blood. We have bacteremia, septicemia, pyemia, and toxemia. What do we mean by bacteremia? Bacteremia معناتها the bacteria get to the inside of the blood in small number and without multiplication. Okay? فإذا small number مثلا with brushing bacteria get to the inside of the blood and cause bacteremia, but the immune system can deal with it, and so most of them are subclinical. لكن المشكلة معناتها في بعض الأحيان أنه بعض المرضى عندهم مثلا أكو congenital heart diseases, so such microorganism may enter the inside of the body and go and settle at the site of the valve, the defective valve, and may cause infective endocarditis. The example of this is Streptococcus viridis. Whereas septicemia. Septicemia means the presence of virulent, highly virulent microorganisms inside the blood associated with multiplication. فإذا معناتها أكو multiplication, there will be an increase in the number of the bacteria and increasing their effect. فإذا this is associated with septic shock sometimes, تصل إلى حد أنه septic shock, and these are associated with serious consequences. The products of the bacterial products will get absorbed from the tissues, and the excessive inflammatory reaction they produce يعني الجسم اللي تيجي ضده يدينا إلى septic shock اللي هو يصير عنده يعني excessive vasodilation, massive vasodilation اللي يؤدينا إلى hypertension، وhypertension يؤدينا إلى tachycardia، إضافة إلى أنه multiple damage in the capillary endothelial cells اللي هو caused by the microorganism itself، يعني بالأخير راح يجينا إلى septic shock. Pyemia معناتها pus inside the blood. زين ايش يعني يحكي هذا pus؟ For example مثلا there is abscess in the lung, okay, in the abscess in the lung or abscess in the soft tissue, and such pus collection inside اللي هو cavity. Sometimes there is erosion in the cavity of the abscess, the nearby blood vessel severe erosion, okay, and such pus material اللي هو including inflammatory cells زائدا bacteria in themselves enter to the damage، تعمل damage للفيزل. الفيزل ما يستبين الدمج أحدنا إلى clot formation. Okay, فإذا there will be clot formation, blood clot nearby abscess. Pus bacteria get to the inside of such a blood clot, and such a blood clot فإذا contains core of bacteria زائدا inflammatory cells. فإذا pus material and such blood clot may يعني thrombus may transmit severe embolism and go get implanted سواء كان من البرين فإذا يسموها septic embolus، وتعمل abscess formation، أو in the lung تعمل abscess formation، in the kidney تعمل abscess formation. Toxemia معناتها presence of toxin produced by the bacteria in the blood. Example diphtheria. This is a photograph, microscopic picture of an abscess. This is fibrous wall of an abscess, aligning a pyogenic membrane or a granulation tissue, and the inner side اللي هو هذا كله removed، هذا عبارة عن اللي هو liquefied pus material. We talk about gangrene. Gangrene means, as a definition, أنه dead tissue with superadded putrefaction. يعني معناتها أنه dead tissue عندي أوكي مع bacterial proliferation. ناخذ اسمه من the Greek term gangrene. Usually أكو different classifications for gangrene. أكو قسم منه obsolete لكن we have the main types of gangrene include gas gangrene from its name يعني associated with gas formation. We have dry gangrene from its name يعني tissue يكون dry, and vent gangrene from its name يعني tissue يكون gangrenous and wet. Starting with gas gangrene. الgas gangrene هو usually caused by microorganisms اللي هي Clostridia species. Clostridia species from its name يعني هي anaerobic فمعناتها they prefer dead tissue ما يحتوي على blood supply ما يحتوي على oxygen for its preparation. فإذا anaerobic gram-positive spore-forming bacteria. They gain entry to the inside of the body. مثلا person exposed to lacerated injury, car accident, فصار عنده lacerated wound, damage مع necrotic tissue بالwound. Okay, decreased blood supply. Spores get to the inside. هي طبعا موجودة بالنيتشر كثير بالسويل فتدخل إلى tissue تبدي بعدين establish their proliferation and secrete their toxins. By the production of toxins and enzymes, they cause lysis of the surrounding tissue. They invade the tissue and digestive tissue. Several species of it, as we have here in gas gangrene, it's caused by Clostridia perfringens or caused Welshi and the Clostridia septicum. This produces cellulitis and gas gangrene, which is life-threatening disease. Septicum usually present موجودة with a stool in the GIT. But when there is ischemia مثلا in the GIT مثلا volvulus صار person عنده twisting intussusception أو مثلا عنده hernia وصار obstruction بالنسبة للبول فيصير ischemia للبول فإذا there will be anaerobic conditions such bacteria will flourish and cause the disease gangrene. How does gangrene occur? That is in gas gangrene. There will be after into the microorganism to the inside of the tissue establish themselves and they proliferate, they produces toxins and enzymes. The best example of this is someone part of it اللي هو alpha-toxin. This alpha-toxin and this cytinase يعمل يشتغل على الcell wall فيعمل lysis of the phospholipids that are present in the cell membrane. So the human cells will lyse. راح severe lysis. Okay. Also, they produce collagenases or hyaluronidase. فإذا collagenases ايش يعمل؟ بالنسبة للكولاجين يعمل lysis للكولاجين اللي هو surrounding the cell. hyaluronidase يعمل lysis للماتريكس اللي هو surrounding the cells. فإذا there will be lysis of the cells, lysis of the collagen surrounding matrix. فإذا digestive extracellular matrix. فإذا make it فإذا هون necrosis here make it easy to spread of the microorganisms to the tissue through the tissue. The tissue اللي هو affected usually يكون black in color. Okay. At the same time الclostridial Welshi تعمل fermentation للsugar present in the tissue فتدينا gases اللي هي carbon dioxide hydrogen and these gases accumulation يدينا مثل bubbles فلهذا اللي نفسك التissue infected تحسه مثل crepitus sensation بالpalpation. This is example of uterus affected by gas gangrene. This is uterine cavity. This is uterine wall. We see multiple. This is necrotic and necrotic tissue. This is necrotic bell necrotic tissue, and this is viable tissue. Necrotic tissue. We see multiple bubbles here. The cavities are occupied by gas produced by Clostridia species. Whereas when we talk about the gas gangrene, here gas gangrene affects usually dry gangrene. The dry gangrene usually affects the distal parts of the body. Here there is a gradual ischemia due to atherosclerosis. فإذا atherosclerosis there will be decrease in the size of the lumen of the arteries, decreased blood supply to the organ. فإذا there will be gradual necrosis, and this gradual necrosis within the tissue راح يكون gradual dryness, decrease in the water content of the tissue. Usually spread slowly يعني proximally إلى أن يصل إلى حد بينه good blood supply stop okay Grossation tissue usually يكون dry shrunken and decrease in the water in it. Okay, dryness. ويكون black in color. And this is black in color because إنه الميكروأورجانيزم proliferating تعمل lysis ما بس إنه للتيشوز والسيلز فقط أيضا للآر بي سي. من ضمن الآر بي سي يحتوي على هيموغلوبين. such hemoglobin اللي هو يتحد مع الحديد الليبيني يتحد مع الهيدروجين سلفايد فيدينا إلى ايرون سلفايد. and this iron sulfide هو black in color وهذا ينطيني اللون الأسود للأفكتد gangrenous tissue. gangrene أنت بتحدثنا عنه بالأول محاضرات سب انجري. histologically بنشوف we see necrosis. okay, الviable border we see granulation tissue. الwet gangrene here it occurs in organs the high content of water, moist organs مثلا بالmouth, بالبول, lung and so on. والcausative here is that أنه there will be a blockage of the venous system rather than أنه الarterial. فما يصير بلوك بالvenous system الأورجان راح يكون عندنا congested. فإذا congested بينه كثير fluid كثير plasma and this يدينا إلى أنه production of wet gangrene associated bacterial proliferation. Bacterial proliferation يدينا إلى usually associated معها septicemia. sometimes إذا مثلا بالgangrene بالsmall bowel. gangrene here in small bowel may spread to the peritoneal cavity يدينا إلى peritonitis. grossly يكون swollen على عكس الدراي يكون dark والبست example هو gangrenous bowels. changes histologically necrosis وإضافة إلى أنه ulceration و other changes that affected the mucosa. wet gangrene الأورجان مثل ما قلنا يكون swollen wet والline demarcation ما بين viable tissue و non viable tissue يكون vague. بينما dry gangrene يكون shrunken و dry والline of demarcation between viable and non viable tissue يكون sharp. Lastly, with this table illustrates the main differences between the dry gangrene and wet gangrene. في dry gangrene common limbs, wet gangrene bowel, dry gangrene arterial occlusion, wet gangrene more likely venous occlusion. dry gangrene يكون dry, black, shrunken بينما الwet يكون swollen يعني يحتوي على fluid كثير. dry gangrene اكو putrefaction بس limited بينما more بالwet لأنه اكو good media for bacterial proliferation and separate يعني الإديما fluid easy separate of the microorganisms. line of demarcation بالdry sharp بالwet يكون vague not sharp. bacteria proliferation in dry gangrene يكون limited بينما بالwet تكون more. والprognosis dry gangrene يكون بصورة عامة better in comparison with wet يعني wet أسوأ كprognosis. and thank you very much. أي سؤال أي استفسار بالchats at least